75, and on page number 75, we finished all that hazards material. Everyone pay attention. These are not too much in your Spider-Man packet. This information I'm repeating, and if you guys will do good, you're going to memorize good. Now, growth and development, we all need to know. 0 to 12 months is solitary play, and also play to play with body part. 3 months, smile, very important. By 3 months, child understands smiling, they're recognizing, and that's normal. 3 to 6 months about the toys, 6 to 12 months about peekaboo. And so it's good. You guys need to know, recognize smiling is normal by 3 months of age. Next box, toddler. What age group come toddler? 1 to 3. You got to know that. And how do they play? Parallel. They don't play together. And write down the word egocentric. They use the word egocentric. They only think about themselves. And they're not sharing. So egocentric, toddler, and also safety in toddler. They are very much looking around and playing. Safety is important. And parallel play. And 3 to 6 is your preschool. Associate play. They can work together. Next is a 6 to 12 is your school age. And school age is you are going to go on cooperative play. So everyone remember the word parallel, associate, cooperative play. And those are, they are working together. Next is Erikson theory. Now it will come in the next pages. Very important is your infant has trust versus mistrust. Next box you will go toddler has autonomy. And autonomy doesn't complete, then they're going shame. Preschool, you have initiative versus guilt. And it explains you if it is positive, they learn the limit. If they don't learn that, they become is more fearful. School age comes industrial. Adolescent comes identity, role, diffusion. And next is, last is Erikson theory, young adult. Young adult is intimacy. You want to be intimate. So very important, you guys read through on your Erikson theory. Next page, 77, is Erikson theory. 45 to 65 is generative versus stagnation. And last, late adulthood, which come above 65, and that is integrity versus despair. And life lacks meaning, negative outcome. They become more negative here. Now, 2 months of age. Next is head sag 1 month. Posterior fontanelle closes 2 months. Then you will go 2 months of age. The toys, they can see mobile toys, soft toys, and head erection. They can keep their head and properly by 3 months. Erect. They are keeping, moving their head. 4 months, toys you have. Then, very important, your fontanelles. Make sure you guys know your early fontanelles are posterior, 2 to 3 months. And if they don't close, there's something wrong with the babies. Teething. When does the double weight? When does the weight double? About 6 months, 5 to 6 months. So they gave you 5 months. Whatever the birth weight was, double 6 months. And teething, they start teething by 6 months. Fear of stranger, 7 months. Then you will keep on moving is on 7 to 8 is larger colored bricks. They can play. They can say the word dada by 9 months. And also, mouth can be child crawling. Crowl will be, crowl comes in exam. And head comes in exam. Posterior fontanelle. And also 10 months. 12 months is birth weight triple. So 6 month double, 12 months triple of the weight is important. And 12 to 18 months, underline line 3, anterior fontanelles. Anterior fontanelles are closing 12 to 18 months. Solid food, then you got to go in solid food. And food one at a time because of allergies. They develop the allergies, so give one food at a time. And cereal is usually first, no cow milk, After 6 months, so when do you start solid food? 6 months of age. And give them cereal, can be mixed with fruit juice. Fruit should be offered in a cup to prevent dental caries. Now you can give them all these food. By 12 months, table food, they can sit at the table. And don't give honey. So remember, juices and honey you avoid in your question because of their teeth. So 15 months, alone child can walk. So after 12 months, they start walking and they're saying how many words. Now, I will advise you, growth and development, very important. If you do not use your growth and development with your child or your brothers and sisters at home, what you have seen, but remember, go from the book. Are we clear? Fontanelles are important, Erickson theory is important. Now, page number 79. 18 months, 12 to 18 months, anterior fontanelles closes. 18 months is your toddler. Is underline the word temper tantrum. So everyone add in toddler temper tantrum. Ignore them. They want attention. 24 months. They can go up and down on stairs. Line 3. Door knobs. They can open them. Then they want to be more independent. Is 30 months. You will go stand on a foot and has control on sphincter training, bowel training. Birth weight can be quadrupled. Next is toddler. Include in what types of toys are included for toddler is you can look on those clothing here and the toys here. Then skip the next one. Then you go 3 years old. Is 1 to 3 is still. They can go on tricycle. Vocabulary increases. Egocentric, I already said toddler, underline egocentric word, temper tantrum word, fontanelles, we all should know. Now they speak more and they have more is wording. They're increasing wording, 900 words. 4 years old, laces their shoes. Independent, 5 years, then you have 3 to 5 is preschool age. Preschool children, age has greatest number of fear because they're going out now. So keep looking on those, and I would advise you, all your toys are here, 7 months, 8 months, 9 months, 9 years, 8 years, 7 years, and then school age potential problem. School age, if you will go in there, and that would be, you skip on and go in the last. Enuresis, encourage before bedtime. Anicoprosis, your bladder control. Head lysis in school age. Fetal alcohol syndrome, babies, mother who is drinking. So, growth and development, please look through. Early growth and development, toddler age is important for you to know. And fetal alcohol syndrome. Child is born, baby is born with mother who is alcohol drinking. The babies are thin upper lip and short up and turned nose, underline. And alcohol can lead to mental retardation and motor retardation, hearing problem. Avoid alcohol 3 months before conception and throughout the pregnancy. Alcohol is not good during pregnancy. Babies are born, they're called alcohol, fetal alcohol syndrome, very important, the lips and the nose and mental retardation. Now I'm moving on, amniocentesis word. In the mother who is pregnant, you're doing amniocentesis, 16th week. Why do you do it? For genetic is for genes. And 30 weeks detect LS ratio. What is LS ratio? For lung maturity. Write down the word lung maturity, and it's called lecithin sphygmomyelin. I will write down the word here, lecithin. 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 L-E-C, then lecithin, and underline the word sphygmo, S-Y-P-H-A-G, then you go myelin. Now, when they give you this word, LS, they use the word LS ratio. Normal is 1:2. So anybody, child who's born early, and they're saying LS ratio 1:1, that means lungs are not mature. Are we clear? So it's a lung maturity test. It's called lecithin sphygmomyelin, LS ratio. It goes in OB question. Whenever you have, if they're saying 1:2, that's normal. 1:1, not normal, lungs are not mature. So why are you doing, one of the reasons for amniocentesis to detect lung maturity. Are we clear? So that is very important. Yes, you can do genetics, but what do you tell? And I want you, void before procedure. Now, before 16th week, if you're doing, is what do you tell the mother? Write down the word full bladder. Before 16 week, full bladder. After 16 week, you got to empty the bladder. So after 16 week, you're doing, and this is one of the question in your teaching. Mother is going for amniocentesis. First thing, why do you do this test for genetic? But very important, LS ratio. Are we clear? What is a normal LS ratio is? I told you 1:2. Now, what do you teach the mother when mother is going for amniocentesis? And your question, before 16 weeks, what do you tell the mother? Full bladder. Are we clear? Drink water, do not empty the bladder. After 16 weeks, then you tell the mother, empty the void before the procedure. They also do ultrasound. So when they're doing amniocentesis, they do ultrasound to see is placenta and fetus. Complication, what do you monitor mother after amniocentesis? Underline the word premature labor. She can start contraction and she can go into labor. Are we clear? So that is one of them. Second thing, I want you to write down the word infection. Mother can get infection with amniocentesis. And number 3, I want you to write down the is bleeding, contraction, and also fetal distress. What do you monitor after amniocentesis? Fetal heart rate. You've got to monitor fetal heart rate. Are we clear? And early labor. So everyone, let me repeat, very important for your exam. Amniocentesis is done for genetic, amniocentesis is done for lung maturity. That's very important. And when you're doing after 20 weeks, after 16 weeks, is always empty the bladder. Before, in your question, before 16 weeks, 20 weeks, mother should be full bladder. And what do you monitor after the procedure? Infection, early labor, contraction, bleeding. And what do you monitor for the baby? The fetal distress. If you know all this, you're done with amniocentesis, the test in the OB question. Next is, I will move on page number 81, is ultrasound. When is ultrasound done? 5 weeks, underline 5th week, 4 to 5 weeks. And what are they looking for? Pregnancy, position of the placenta. When they do ultrasound, they already know for placenta. What are you looking in placenta? Where is the placenta? Are we clear? And what is abnormal placenta? Write down placenta previa. This is abnormal placenta. So if you do ultrasound and they can see and they can feel the placenta is in the lower uterine segment, they will tell the mother she's going to start bleeding. This is not normal. Are we clear? So how do you know early? By ultrasound. When they do ultrasound, they already know the placenta is not normal. And which placenta is abnormal right from the beginning? Not abruptio placenta. Remember, this is the uterus, and if the placenta is here, that's abruptio placenta. That's normal. But if they are seeing placenta is previa, this is placenta previa. So what happened as the baby is growing? Mother start bleeding. So doctor will tell the mother when they have done ultrasound, you have a problem in placenta. So be careful, you might start bleeding because you may have risk of what? Placenta previa. So what are you looking? You're looking the baby, you're looking the placenta, and you're looking for risk for mother to have abnormal placenta. So when do you do ultrasound? 5 weeks. And also, what do you tell when you're doing ultrasound? Drink a lot of water before the procedure. Full bladder may have clear image. So full bladder and drink water. Non-stress test. What is a non-stress test? 28 weeks. And what are monitoring here? Very important non-stress test. So if you don't know, you can read more, but I will explain you very simple thing, and you must remember non-stress test. The meaning is you're not doing anything. You're not giving any medication here. And what do you monitor here? Always keep it in mind. You're monitoring the baby. And what are you monitoring? You have there baby movement. When baby moves, then what happened to the baby's fetal heart rate? So what are you monitoring? Fetal movement and fetal heart rate. So when baby is moving, what happened to the baby's fetal heart rate? Are we clear? So what is a non-stress test? Is a test to determine the fetal heart rate and during fetal movement. When the baby is moving, what happened to the heart rate? Are we clear? And what do you do is fetal heart rate acceleration. What is your normal here? Underline the word 15 beats and lasting 15 seconds in 20 minutes. This is your normal. Are we clear? If they give you 13 BPH or 20 in 40 seconds, that is not normal. Are we clear? So this is normal. Your 15 beats in 15 seconds and you're only monitoring for 20 seconds. So how do you monitor fetal heart rate? And what do you do? There is a monitor for the babies and they're checking the fetal heart rate. So it goes in graph. What do you tell the mother? When baby is moving, write down. This is the way they ask you. What do you teach mother when you're doing non-stress test? So you will say, you will tell the mother, press the button when she feels the baby is moving. Are we clear? So what does she need to do here? Press the button. When does she press the button? When fetus is moving. So what happened? They're tracing the fetal heart rate and they will know how many times mother press and they will check the fetal heart rate. Are we clear? So what are you checking here in non-stress? There's no drug. Mother will lay down and you will turn the mother on the left side to prevent what? The blood and going good and not prevent hypotension. Turn the mother on the left side. Tell the mother what? Press the button when the baby is moving. Are we clear? And that is your teaching question. Now, so non-stress test. What is a normal? How long do you monitor? 20 minutes. What is your normal test? 15 beats during 15 seconds. Contraction stress test. Now, when you have stress test, contraction, placenta respond to labor, done 28 weeks, Fowler position. When they're saying stress test, underline the word, what medication do you give the mother? Pitocin. Are we clear? So they're giving Pitocin, and Pitocin is causing contraction. And what position do you put the mother? Is semi-Fowlers or Fowlers. And positive means are late deceleration, indicate potential risk for baby. Negative means no late deceleration. Now you guys remember what is deceleration means are. What is deceleration means are? The fetal heart rate is dropping and there are 3 deceleration. Now what is a late deceleration? What is the meaning of late deceleration? Mother is either bleeding, and what is the word is called? What is the reason for bleeding? Write down the word abruptio placenta or bleeding, and second word they will use is placental insufficiency. Placental insufficiency. The meaning is placenta is not getting enough blood. So if they give you a question, what is late deceleration? Is bad. The fetal heart rate is dropping and is not going back normal. What does it mean? Mother is bleeding or placental insufficiency. So what is 2 tests you do? One is called non-stress. Second is called a stress test. What is a stress test? When they give you, you're giving Pitocin and you're monitoring the heartbeat. And if they're saying negative, negative means there is no deceleration. The heart rate are doing good. Everyone is okay? So when mother is having contraction, the fetal heart rate is good. That is called so these are very important for your Nclex. So everyone, is, what is the late deceleration means? Mother is bleeding. What do you do if they give you a question, mother is admitted and she had late deceleration? What do you do? Can you do much? No. What do you do when you have late deceleration? You are bleeding and your blood pressure is dropping. So what do you do? Turn the mother on the left side and check the vital sign. Stop the Pitocin and monitor fetal heart rate. So everyone is okay? Late deceleration comes from what? Abruptio placenta or placental insufficiency. I want you to write down late deceleration. Variable deceleration, everyone should know. Variable is not good. When do you have variable deceleration? Is what do we call prolapse cord. Prolapse cord. When you have cord, they use the word either prolapse cord or cord compression. Mother is admitted and mother has prolapse cord and mother has a cord compression. What kind of deceleration you are monitoring? Variable deceleration. Now what do you do for mother when she has cord compression or prolapse cord? What position do you put? Knee chest. And what do you do? Maybe second, give mother oxygen, 100% by mask. Cover the cord with normal saline. Write down that. And what do we do? The fourth answer. Now you can remove the presenting part. So what they do, don't touch the cord, and the doctors or the nurse, we wear the glove. And this is a cord and this is baby's head. So what are you pushing? The presenting part. Why? Because what happened, the cord is getting pressure with the baby's head. So what are you improving here? Circulation. So these are the answer. Everyone, mother comes in prolapse cord and is called variable contraction, variable deceleration. What do you do? Knee chest position, give oxygen and give normal saline and stop the Pitocin. And number fourth, cover the cord with normal saline. And also remove the presenting part. So remember the word removing the presenting part by putting the gloves and removing the baby's head. Are we clear? That is your variable deceleration. These are bad in your question. Early deceleration is normal, is coming when baby head compression. Head compression means baby head is moving down, is normal. They go back normal, the little deceleration, but they go back normal. Are we clear? And I gave you the heartbeat in your, some of the pages I gave you, and I gave you your variable, EKG, and the other, you guys have an exam cram, I gave a copy that comes in exam. You must know which one is variable, which one is late, and which one. That is like your EKG. I gave you in your notes. So everyone remember, this is OB. Late deceleration comes from bleeding. Variable deceleration comes from cord compression. And what is early deceleration? When the baby head starts coming down, is normal. You don't have to do anything. Are we okay? So I covered that. Everyone should know non-stress test. You should know contractions test and torch. What is the word torch? Is infection. During pregnancy, that is OB question. And diseases that crossing from the placenta, and number one, T means toxoplasmosis. And how do you get toxoplasmosis? From cat litter box, gardening, and uncooked meat can lead to, but a lot of questions with litter box, you can get that, okay? So remember, wear gloves, very important. Cooked meal is important. Rubella is causing is what? German measles, right? Rubella infection. And less than this, cytomegalovirus virus you can get from body fluid. Herpes, so what are the, they're saying T means toxoplasmosis, O means other infection like rubella, cytomegalovirus, and H, herpes, you have herpes simplex. So these are some of the infection. Other, you will have rubella, you have with R, rubella R, and C, cytomegalovirus virus, H means herpes. Are we clear? Now these are common infection. So if they ask you what are the common infection during pregnancy, toxoplasmosis, and that comes from cat litters. Okay. Now this infection can lead to congenital problem in the baby. So mother need to be treated. Now next is UTI, client with having UTI, syphilis and gonorrhea. UTI can lead to pyelonephritis. What is pyelonephritis? Is pelvis of the kidney. Kidneys are bad. UTI simple means right here. But when keep on getting UTI, what happened? Infection goes up to where? Back to the kidneys. And pyelonephritis word is your infection has gone inside the kidney. And whenever you have pyelonephritis, where is going to be the pain? Where does the patient would have pain? In the back. And they have fever? Yes. And what will cut down here? Same as kidney problem. Low urine output. Color of the urine will start getting darker. Are we clear? Blood in the urine. So they're saying UTI can lead to what? Pyelonephritis and risk for premature birth. So you don't want mother to get infection. You don't want mother to get pyelonephritis. Syphilis can go second trimester, can lead to congenital infection and abortion. Gonorrhea affecting the eye. So we are saying UTI, syphilis and gonorrhea can lead some problem. Now also toxoplasmosis, rubella, cytomegalovirus virus, herpes, they can lead to all these infections. We already said if mother has herpes, you do the C-section. Don't let them do normal delivery. What are the danger sign of pregnancy? They're not normal during pregnancy. Number one, bleeding. If mother is bleeding, do you think is normal? No. What are the reasons for bleeding? You have placenta previa, write down, and abruptio placenta. Regular uterine contraction. Mother keep on getting contraction too, is not good. Headache. What is headache and visual and abdominal pain? Sign of pregnancy-induced hypertension, and what is another word is called? Preeclampsia. Any question with vision, with headache, you monitor mother for preeclampsia. What is the complication of preeclampsia? What is the complication? If they give you, mother is having hypertension or mother is having preeclampsia. Now, what does hypertension, preeclampsia can lead to? They can go in aneclampsia, they can go seizure, and also remember, these two, because of the blood pressure is high, mother start bleeding. What are you monitoring the mother here? What do you monitor mother? Abruptio placenta. There was no reason mother should have bleeding. But why mother is having bleeding? Because your mother start having hypertension. Are we clear? And what bleeding they have? Write down abruptio placenta. Abruptio placenta means normal placenta. And where is the normal placenta? Write down in upper uterine segment. It was normal, but because of mother's health. So everyone always, remember what they are saying, pathophysiology. What are they saying? You cannot memorize unless we understand. So if mother has abruptio placenta, there is no reason. Because normally, where is the placenta? In upper uterine segment. Are we clear? So which placenta you have in upper uterine segment? Abruptio placenta. Placenta previa is in lower uterine segment. Are we clear? Are we okay? Lower uterine segment. What does it mean? The doctor already know they're going to start bleeding because placenta is not normal. But here the placenta is normal and mother has hypertension and preeclampsia, then what do you monitor? They give you question. Mother is admitted with hypertension. What is the mother is going to be risk for? Bleeding. Are we clear? Abruptio placenta. That is why we need to monitor and prevent seizure and bleeding. Now, what do you monitor if they say mother has, so I want you to write down like that, is hypertension, preeclampsia leads to abruptio placenta. And what is the complication of abruptio placenta? What is the complication of abruptio? Mother is bleeding, and remember, the bleeding might stay back here. It's a bleeding and clotting disorder. What is the disorder is called? Very good. DIC. Remember, abruptio placenta is leading into what? DIC. What is DIC? Disseminated intravascular coagulation. See how your questions are. See, questions are not straight. Patient has DIC, what do you do? Which patient are you going to monitor? Somebody who's having liver problem, somebody who is having infection, and the word is called, so I want everyone remember, DIC come from, is preeclampsia, eclampsia, and abruptio placenta. DIC comes from sepsis, not only in OB. In OB, mother got severe pneumonia and has a bad pneumonia and septic. She can go in bleeding disorder. Are we clear? What is another reason for DIC? Can be your liver problem. Liver problem. Baby stays too long in the fetus, in OB, they can go in DIC. That covers your DIC, but you got to connect. Are we clear? So we talked about I'm glad you guys have here, a lot of OB questions are in exam. Late deceleration, early deceleration, variable deceleration we should know, amniocentesis we should know, stress test we should know, non-stress test we should know. Are we clear? And now we already said DIC. What is the treatment for DIC? Remember, what is DIC question in MedSurg? Treat them for bleeding, and medication you're going to give, heparin. And if they ask you, how do you know your patient is improving? How do you know your patient is improving? How do you know your patient is getting better? You're giving heparin, and how do you know your patient? So remember, what is blood is? It's a bleeding disorder, but where is the blood is going? Throughout your body. So now what will happen? Your blood circulation will improve. Being a nurse, how do you know your patient is getting better in your assessment?
Vital signs.
Vital sign. And second thing, urine output, your kidney. So this may be your answer. How do you know your patient is improving is, what do you monitor? Urine output. And you do monitor vital sign. Are we clear? And how do you know patient has DIC? You may see bruising. You may see the word ecchymosis, bleeding disorder. So everyone should know what is DIC, disseminated intravascular coagulation. How do you treat them? By giving heparin. Are we okay? So I want you guys, bleeding, we all should know abruptio placenta and placenta previa. Which one has a pain in bleeding? Abruptio. Which one has no pain? Placenta previa. Which one are you going C-section? Which one?
Previa.
Placenta previa. You cannot do anything vaginal. Abruptio placenta baby is higher up. If baby is stable, they can remove normal or they can go C-section. But you will never do vaginal exam and vaginal delivery in which one? Placenta previa. Are we clear? Bed rest, no vaginal exam, no vaginal delivery. Now, next is headache, we already talked about. Infection is not good. Swelling, PIH. What else do you need to monitor? Mother for danger sign of pregnancy, or they gave you is bleeding disorder, and also for preeclampsia, you should know eclampsia. DIC, I said already, you guys need to know that. And onset of labor. How do you know the mother is in labor? Lightning. What is lightning? Baby is dropping in the pelvis, going down. That's a lightning. When does lightning take place? Primipara, 2 weeks before delivery. Multipara during labor. It go faster for them. The baby moved faster. Softening of the cervix. and underline the word mucus plug. What is a mucus plug? Is that blood-thin mucus secretion. So when mother is increasing blood, we release what we relieve, we call the mucus plug. That means the blood is coming out. When do you see mucus plug? When do we see? Stage 1, you are having contraction, baby is moving, and before you're going in second stage of labor. Are we clear? So what happened? The baby is moving down and all the bleeding is coming and the mucus plug is relieved in when? During end of your first stage. Braxton Hicks contraction. What is Braxton Hicks contraction? What is Braxton contraction? False contraction throughout the pregnancy. Write down that wording. Braxton Hicks contraction, the mother is having contraction throughout the pregnancy, and that is a false, not true contraction. Prolapse umbilical cord. What is that we call when you have prolapse? Is variable deceleration. We already talked about it. Is presenting part is sometime when the baby is very high and the baby is not moving, you can have prolapse cord. So underline presenting part not engaged. Engaged means the baby's head is not coming down, is not engaging. And write down it can lead to fetal distress and protruding cord. We already talked about knee chest position. Cover the cord with normal saline. Are we clear? And next is, what do you do? Call for help. Push up against presenting part of the cord. What I was telling you, use the hand and remove the presenting. Now you can go knee, chest, and Trendelenburg position. Check the fetal heart rate. So remember that. Now we finish page 82. Let me finish few things before we finish for this session. Then we will start at 2 o'clock. Early sign of fetal hypoxia. What is early sign of fetal hypoxia? Is, remember, bradycardia or tachycardia. So what is your heart rate? What is your normal fetal heart rate? 120 to 160. So if they give you 100, that is bradycardia. If they give you 180, that's a tachycardia. Are we clear? So fetal heart rate goes down or goes up. That can lead to fetal hypoxia. Do you know about informed consent? Is witness patient sign. Nurse can witness. Can you witness? Yes. Patient has age to capacity, adult and confident. So what is the meaning here? Is patient is able to understand. Are we clear? And you have them sign the consent. And underline the word, do not give medication, your sleeping pill, anything make your patient sleeping. Also add their language. And write down the word competent. Very important word. Which patient you will have consent to sign who is competent? Are we clear? Who decide patient is competent? Who will decide? The doctors. We don't. So where do you look your patient is competent? In the doctor's notes. Are we clear? Now we do not decide. If I'm a nurse in night, I might say patient confused. Evening nurse might say patient is slightly confused. Morning nurse may say patient is very alert. But the doctor is the one. So before you sign, I'll tell you, when we go to the court and we present our case, the first thing, a patient refused restraint, and they're going to ask us, how do you decide your patient is competent to sign the signature? And they're going to look if, and there is a form in the doctor's physician notes when they assess, there is a section and it says, your patient is competent. And it says yes or no. And it says, can patient make decision? Now decision can be consent, can be bank, can be anything. Can patient make a decision? And it says yes and no. Now doctor here he said no, and here he said no. Can you have your consent signed by your patient? No. And if you go to the court and you have this in the doctor's note, we are in a big trouble. Are we clear? So very important understanding. We all know patients should sign, but who do you get patient sign the consent? Number one, who is competent. How do you know patient is competent? By the physician assessment and the doctor declare your patient is competent. Are we clear? Number two, not influence of the drug. And number three, language. Somebody doesn't understand English. And you got to get somebody who can talk to them in language. See, your questions are not going to be who signed the consent patient and how do you is one word. They may say patient speak only is language Spanish and doesn't understand English, or speak Indian or speak Filipino and they don't understand English. Can you have them just here is the point and know, and your patient is doping with the medication and sleeping and say, oh hey, here, you signed, here I put this, just put your initial here. That's a big problem. We cannot get the consent. And before you do anything where you need a consent, what do you do before you put a restraint, before you give chemical restraint? Check for consent. Maybe you are off for 3 days. The doctor has DC the medication, or patient says, I don't want any more this medication. Every time in your question, before you tie your patient, before you give chemical restraint, what do you check? Consent. Very important on consent. Nurse must make sure questions are answered and form is attached to the chart. We all should know consent. Early deceleration is normal. Underline the word decrease in heart rate and underline the word head compression. We all know variable, we know, early we know, and late deceleration comes from what? Bleeding. And write down the word placenta previa, abruptio placenta, or placental insufficiency. Sometimes they give complicated word. They give you placental insufficiency, means the mother is not getting blood. And what do? We already said stop Pitocin, turn the mother on the left side, or Trendelenburg position and give IV fluid. Variable deceleration, underline the word compression. Now you guys have all deceleration. What are the signs of labor? I will finish until at the end of this page. Regular contraction. Remember, they're getting regular duration, and the pain is in the back, and contraction does not decrease with the rest. Patient goes in a bed, still the contraction. Always true contraction comes in the back. And also effaced and dilated. What does effaced mean? Thinning of the cervix. So cervix is getting thin and effaced. False contraction, irregular. And discomfort is abdominal, decrease with the rest, and no cervical changes. And where does this false contraction come? In the lower abdominal area. So that's not good. Back is normal, but if they come lower, abdomen is not good. So I think I will stop here. The contraction we are done, and I'm very glad that we have a lot of OB on this and the other things. So this covers you up a lot of information. So we'll start back at 2 o'clock. So if you're